Welcome back to America Decides. Since Roe versus Wade was overturned, 14 states have implemented near total abortion bans. Ohio currently has a 6-week abortion ban. However, the issue is on the state's November ballot. If approved next week, a referendum would amend Ohio's constitution to guarantee residents the right to make decisions about reproductive health care, including abortion. Early voting is underway there as Idaho experiences a mass exodus of doctors in response to its abortion policies. CBS News correspondent Adriana Diaz joins us here with more. And Adriana, you actually went to Idaho. You spoke with a mother who was personally affected by this new abortion law. We want to warn our viewers that it's pretty emotional and difficult to hear, but let's take a listen to that interview.
There was a really, really intense contraction and my water broke. We went to the bathroom and then ultimately I gave birth to the baby in the hotel bathroom. I had to stifle cries because, my child is on the other side of the wall.
In her pack and play.
In her pack and play. Sleeping. And my other child is sitting in the hotel bathroom.
Very difficult to listen to, and I'm sure difficult to do that interview. But in terms of her situation and others like her, is this becoming more common for mothers in Idaho? And how big a role is the legislature and this new law playing?
Nicole, this is definitely more common. There are other mothers like Becca. These are mothers who want to have children. These are wanted pregnancies. And in the case of Becca's, like others, they're non-viable pregnancies. So a stillbirth is expected. The child had many abnormalities to the brain, to the kidneys, to the heart, and wasn't expected to survive. Before Idaho's ban went into place, she would have had an abortion in Idaho, done by her high-risk OB. After this ban came into place, it was a trigger law, like in a lot of states. They basically passed laws that would be on the books if and when Roe was overturned. So when that happened, all those triggers basically were, took effect. And so those laws became the law of the land. But if, her preference would have been to have her abortion in Idaho by her doctor, that doctor is no longer in Idaho because most of the state's high-risk OBs have left the state. They say that this law, we spoke to them, Jessica Kagu, our producer on this, spoke to many of them directly, and Becca's high-risk OB said that this law basically degrades her ability to do her job. That was the word she used.
She had no choice.
She had no choice. She had to go to Portland to get this procedure. It went really poorly. She ended up in her hotel in the middle of labor. Her 2-year-old was with her because they didn't have childcare. And it was enormously traumatic and something that she and her doctor felt was really unnecessary.
You also talked to a Republican lawmaker in Idaho who seems to be evolving with respect to his position on this issue. Let's listen to that.
Did Idaho go too far with this abortion ban?
No, I think it's a good starting point.
What changes do you want to see to this legislation?
We have to have something in there that includes the health of the mother, not just the life of the mother, because health and life are two different things, in my opinion. And I must say, I'm pro-life, but I'm also pro-life for the mother, too.
So it sounds like he kind of wants to make some tweaks here to this legislation, but how much of this is an uphill battle?
I think it is an uphill battle because even though he is someone who is a Republican, he identifies himself as pro-life. He talked about that a lot in our interview. This has been tried before. Earlier this year, they tried to amend this ban to include abortions being allowed, being legal if they protect the health of the mother, not just the life of the mother. And that didn't make it into the legislation. So that's already been struck down. He wants to try again. And his hope is that if other lawmakers, his colleagues who, are staunchly no on this issue, hear more testimonies from women like Becca who are affected, he's hoping he can turn them around. But I have to say, Nicole, on this issue, people are dug in on both sides. It's so rare to see someone kind of ride the middle in that way, especially a lawmaker in this way. And he was very candid, and, he still felt that his beliefs were intact, but he felt that there needed to be some wiggle room, some flexibility to protect mothers, as well as, in his view, the unborn children. So, it was very unique and unusual to hear that perspective.
And then just very briefly, you talked a lot about how doctors are now leaving the state. How is that impacting healthcare there?
There's a maternal health crisis in Idaho. There's no other way to put it. Already, many doctors have left the state. They say they can't work there. And for a doctor to leave their patients is huge. You know, doctors get into this work because they care about their patients. So for them to feel so kind of hamstrung that it forces them to move their families, that says a lot. And lastly, I'll just tell you that already 2 labor and delivery units in the state of Idaho have closed down, and one of those hospitals specifically cited what they say is the criminalization of doctors' work.
Wow, Adriana Diaz with some very important reporting. We know you'll stay on it, and thank you so much.